Welcome to Monday's edition of COVID-19. We are starting this work week with the daily tally slightly below 600, but authorities are pointing to a disturbing trend with regard to infection numbers at the start of each week, despite the fewer testings over the weekend. Our Consua has more on this reality, while our panel of experts touch upon the resumption of AstraZeneca vaccines later on in the program. Right then, so let's start with the local coverage.
Yes, Sunny. Korea confirmed around 30 fewer cases this Monday, 587 to be exact as of 12 a.m. So not a drastic change. These infections include 560 domestic transmissions and 27 cases from abroad. So the country's total caseload has surpassed 110,000. And over the weekend, the number of people who made a full recovery has also hit above 100,000. Now, the highest number of infections this Monday was reported in Gyeonggi-do province, followed by the capital Seoul. And with the widespread infections across the country, social distancing measures have been extended for 3 more weeks. And then in the capital region, as well as down in Busan, nightlife entertainment facilities have been suspended. And another rule that's took effect this Monday is, or has been simplified and has made harsher, is regarding the proper wearing of face masks. Now, citizens can be fined with 100,000 won, or roughly $89 if they do not wear face masks at any indoor settings.
I see. Meanwhile, so the daily average of COVID-19 cases in recent days has stood past, that is, 600.
That's correct, Sunny. Although the daily caseload did drop to the 500s this Monday, we have to consider that the number of tests over the weekend was around half of that we see on work days. That's why we have over 600 cases over the weekend. And if you take a closer look at the on-week change in numbers here, we see that these are the Monday caseloads that we are seeing. So this is an upward trend that we are seeing here on this graph. And a reason for why vaccination process has to proceed in a swift manner. Now we have at least 1.15 million people who have received at least one shot of vaccinations, and more than 60,500 people who received their second shot. Meanwhile, this Monday, the use of AstraZeneca vaccines has been resumed. We will have later in our program more details on that. And concerning too is the daily rise in infections around the world. Over 600,000 infections and more than 10,000 fatalities in the span of 24 hours is pretty high regarding that it is Monday. And next we have the 3 countries with the highest number of infections. What's notable here is that India has surpassed the total caseload of Brazil at 13.5 million and almost 170,000 new infections in the span of 24 hours as of noon Korea time. You will later connect to India for a closer look at the situation there. And also resurgences in European countries like France, who just hit 5 million cases recently, and also Germany with 3 million infections. Here, the proportion of younger patients is on the rise. And those are the updates that I have for now, but I'll be back in a bit after the government briefing. Sunny.
All right, so thank you for now. Right, as mentioned earlier, India is battling a fresh wave of the pandemic that pushed the daily tally close to 170,000 cases over the past 24 hours, as our Swa just mentioned. For more on the situation there, I have Tarun Kalyanam live on the line. Hello, Tarun.
Yeah, hi, Korea. This is Tarun from India.
Right, Tarun, let's begin with the reasons behind the alarming resurgence over in India.
So one of the biggest reasons was the people have been not even particularly wearing the protective mask, and they have been not knowledge about those all things. And there are fewer uneducated people also here, who are staying in downtowns. The people don't even know about what the mask should wear and which shields they should be used, and proper usage of sanitizers. And present now, the polling's also been going so faster. The elections also been moving forward. So the urging of the government, people should be so alert about this COVID-19.
Tarun, back in March, India identified a variant with 2 mutations to its genetic composition. What has been disclosed thus far about this double mutant?
Yeah, it was an year on for us, COVID-19 here. It was an anniversary for us about the COVID-19, but we can see the second wave is much faster than the first one. The basic thing, Indian government was not flexible about those things, and they have been not claiming about these double mutations. As per the doctors of India who have been dealing with COVID-19, they have been saying that every single mutation could not affect you much, but double mutations could hit up the COVID-19 percent very majorly. This was the one of the big thing, the grids which have been going on in this India as far as.
I see. Tarun, meanwhile, on the vaccination front, what is the latest with regard to public inoculations in India?
Yeah, the vaccinations have been going so much good. There wasn't a false statement moving around the world about the Indian nation government has been taking about, but vaccinations are going very good in this India, and there wasn't a good immunization response. There wasn't a about of who are affected with COVID-19 cases. They have been given plus vaccinations, and who are plus 45 age. They are also given the vaccination so good, and the vaccination response is also so good, which you can found that in UK countries, UK nations and etc. where some blood clots also have been found. But in India, there was nothing like that. And doctors have been day-to-day monitorized about all things. And present up to now, the administration has given a prox of 8 crore plus doses for us. And 7 crore plus for first dose and 1 crore plus for second doses also now been going on good.
Right. Tarun, let me clarify if I heard that correctly. There have been no cases of blood clots with regard to AstraZeneca vaccines in India then?
Exactly. There was no cases present right now. No blood clottings also has been seen in the India. But doctors have been not taken much easier also. They've been for every person who has been affected with COVID. So they've been checking their blood tests also cleanly and transparently about all things.
I see. Meanwhile, Tarun, what is the latest with regard to India's decision to halt the exports of AstraZeneca vaccines?
Yeah, that was not the permanent decision about the AstraZeneca vaccine. It wasn't a temporary thing. Why? Because you can find the 14 times faster for us for the COVID-19 cases have been hiked in the India. So one of the biggest reason to put on hold for the AstraZeneca vaccine to export it out. You people already know that India has been already exported about of 60 million of doses all over of 76 plus countries here. So, but for present situation in the India, it was very serious and very emergency situations. So that's the reason everyone has been taking out the vaccinations, and so that's the reason it was put on hold about the AstraZeneca.
Tarun, how are authorities in India seeking to stem the current unsettling spread of the virus in the country?
Yeah, I already said you before like that. People have been so negligent about what they've been doing about the putting on the masks and etc. Why? Because the people are using the cotton masks. They don't even have the proper knowledge about things. As we already know that the doctors have been suggesting about the using of N95s, shields, proper distance making. But in the few more of the states like which have been cases have been hiked, like Maharashtra and Tamil Nadu, they have been giving the lockdowns for the nighttime and weekend lockdowns also, and all the holiday spots have been banned. So this was one of the biggest situations have been taking place in India.
I see. All right, Tarun, thank you very much for joining us live at this hour with your thoughts.
Yeah, thank you, Arirang, for giving me such a good opportunity.
Right then. Up next, we are poised to join the regular briefing on the COVID-19 situation here on the local front for this Monday. Now, while social distancing has been maintained at either level 2 or level 1.5 across the nation, some stringent guidelines are in place to address the recent rises in daily infections. Now, one such measure includes fines against those who do not wear their face masks at indoor venues. Violators face a fine of 100,000 won. Now, while we wait for the briefing to commence, let's take a look at Korea's COVID-19 prevention efforts in place until the 2nd of May. Level 2 distancing measures are in place here in capital Seoul, as well as a few other regions, including Ulsan, starting this week. The rest of the country faces level 1.5 social distancing. The ban on gatherings remains in place, with 5 or more people not permitted to meet for social purposes. Businesses including movie theatres, internet cafes, video game arcades and cram schools face no limit on operation hours. The briefing's about to start. We'll come back to you afterwards.
As of today midnight, we have a total of 560 new local infections and a total of 27 new imported cases. The total caseload now stands at 110,146. And yesterday, we had over 40,952 tests being conducted. And in the makeshift testing centers in the metropolitan area, we carried out 17,701 tests, confirming 70 people with the COVID-19 virus. And we also have 695 more people being discharged yesterday, while 7,572 people still remain in quarantine for treatment. And the number of patients with critical or severe conditions decreased by 2, standing at about 103, and we had 2 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. And as for the latest major cluster infections, please refer to the latest press kits that you have been given. And as for the details of the weekly risk assessment indicators, here are some details. And during the past week, we have had 579.3 average daily cases, which is up by 102 from the previous week, which is also up by 20%. And aside from Gangwon province, in all of the provinces and cities, we have seen a major increase of the daily tallies. And also the proportion of the daily tally in the non-metropolitan area was also on the rise. And looking at the reproduction indicators, we also see 1.15 nationwide, which is about 0.05 higher from the previous week. And this is also above the level of 1 in all areas, including the metropolitan area. And what we are also concerned about is the fact that for the second consecutive week, we have seen the index standing above 1, which means that we had a steady rise in the number of new patients. And in accordance to the total tally increase, we also have had the increase in the fatalities as well as the accumulated people in the critical or severe conditions. However, our fatality rate, which stands at about 1.61%, is on a steady decline. And as for sources of infection, we have seen a decline in the number of local transmissions. However, we are seeing an increase in the transmissions from those people coming into contact with previously confirmed cases. And also for the 4th straight week, we are seeing the reproductive rate also increasing, which is standing about 1% right now. And after the 4th week of March, we are seeing an increase in our imported cases. And as for the daily average of the imported cases, we are seeing 22. And also during the past week, we have seen about 155 cases of the imported cases throughout the past week. And among them, about 120 are from the cases in countries that are in high monitoring. And we also have cases being confirmed at the new militaries as well. And as for the new variants, last week we carried out the sample testings for about 670 cases. And we also believe that from these 670 cases which are local, we are seeing 20 cases of new locally transmitted new variants. And also as for the imported cases, we have been looking at the virus of 52 cases, and among them 29 of them, which is about 58%, have been tested positive to become the new variants. And we also see about 392 cases of the new variants right now, and majority of them are from the UK variants, and 46 are the South African variants, while the Brazilian variant stands at 9. And also some of the risk factors are as follows, and here are also some details of the government's quarantine measures. And right now, we are seeing the virus spreading through the local facilities like the singing rooms, as well as public saunas and indoor sports facilities, which are prone to virus infections. And we have seen an increase in the local transmissions stemming from these areas. And we also have seen a rise in the number of local infections, especially between the people-to-people contacts. And this is also being resulted from the seasonal factors as more people are enjoying outdoor activities and also enjoying more gatherings and meetings. To this end, we would like to also bolster our quarantine measures for the public use of facilities and workplaces. And to this end, we will be carrying out with the local governments, we will be carrying out the intensive monitoring, and we will also be working closely with the government ministries and look at the multi-use facilities and make sure that no facilities breach quarantine measures. And if there are breaches, we will also take stern measures as well. And in order to bolster our local transmissions, quarantine measures that is, we will be carrying out massive testings and also tailored quarantine measures for specific places as well. As for people with clinical symptoms, we will be advising them to get tested as soon as possible, and we will also intensify our quarantine measures for religious facilities and tourist destinations, and we will be working closely with the local governments to this end. And also, as for the COVID-19 vaccination status, here are some details. As of April 12th midnight, we have seen 305 more people getting their first dose of the COVID-19 vaccines, with the total recipient standing at 1,157,255. And as for the number of second dose recipients, the number stands at 60,511. And as for the Q2 eligible recipients, we have a total of 305 more people getting the vaccinations, and the vaccination rate stands at 9.4% for the second Q people. As for those people above the age of 75 and also people at the nursing hospitals above the age of 65, we also have more than 170,000 people receiving the vaccination so far. And also starting from the 24th of March, we have been administering the vaccinations for people at the nursing hospitals and and long-term caring centers above the age of 65. And also their vaccination stands at 62% and 48% respectively for the residents and workers at these facilities. And as for the nursing hospitals, we have also completed the vaccinations for many people, and also first responders, we have carried out the vaccinations for about 62,000 people, and the general hospitals, we have administered the first dose to over 35,000 people. And the second dose of vaccinations is given out at COVID-19 hospitals, and a total of 60,000 people have been administered with the first dose, while another 65,000 people have been administered with the second dose. And as for the adverse responses after inoculation, we have a total of 11,626 cases, and among them, 11,439 cases are reported to be mild and common symptoms after inoculation, including muscle pain and headache and fever. And we had 114 suspected cases of anaphylaxis and 26 suspected cases of severe cases and 42 cases of deaths. And starting from today, we will be rolling out vaccines for flight attendants and also caregivers for the disabled. And we are also starting the reservations of the vaccinations for these group of people. And as for these group of people, they will be administering with their vaccines starting from next Monday, and they will be given the AstraZeneca vaccines. And the reservations will be carried out in terms of the local authorities, and also they will be administering the drugs at the local vaccination centers designated by the hospitals. And we also have Mr. Kim Jung-gon, who will be explaining about the compensations for the vaccinations. On the 9th of April, we have had the 6th round of our meeting of the committee meeting on the damages of the COVID-19 vaccinations. And as for the 11 cases of death, they have been investigated. And based on our accumulated data, we have seen that they were death due to other causes, and they had a low correlation with the COVID-19 vaccines. So as for the adverse responses after inoculation, we have seen it will be difficult to acknowledge the correlations with the vaccines. However, we are having 3 cases which is undergoing autopsy right now. And as for these cases, we will be providing the details upon the completion. And as for the severe cases, we have been looking at these cases as well, and here are some details. And we have been looking at 4 cases of the reported suspected severe cases, and 1 case has been reported to have the correlation, while the rest of 3 did not have correlation. And this 1 case has seen severe headache after 3 days of inoculation, and after the diagnosis, this person has been diagnosed with the CVST. However, there was no decrease in the number of blood pellets, and so we believe that this is also not under the classified case of the blood clots that has been diagnosed by the EMA earlier. And we also have seen that there were no specific other correlations, and we also considered that the frequency was very rare, and thus we have acknowledged the correlation with the COVID-19 vaccine. Luckily, this patient has been fully treated, and also this person has been discharged from the hospitals and returned to his or her workplace. And as for all of the 3 other cases, these people have also experienced some symptoms after about 10 hours of inoculation. However, we have seen that these were the causes of other causes aside from the COVID-19 vaccine itself. And also after the vaccinations, we have also seen that there were also like blood clots as well as other diseases after the inoculation, and this person was also in her 20s. And we also have seen that this person has also experienced the similar blood clots with due to the underlying medical conditions. Therefore, no correlation with the vaccination has been admitted. And we also have seen another case of a woman in her 70s, and this person experienced a bleeding after inoculation. However, we believe that this has been due to other causes as well, which we see that it has a low correlation with the COVID-19 vaccine. And this concludes our monitoring process.
네, 그럼 지금부터 기자님들 질문에 답변 드리는 시간 갖겠습니다. 출입 기자단으로부터
Monday's afternoon briefing with Lee Sang-won as well as Dr. Kim Jung-gon from the Post-Inoculation Investigation Task Force.
Right, Sunny. Let's begin with the general updates by the official Lee Sang-won. The number of domestic cases on average in the past week stood at around 579. That's up by 102 from the previous week, so a rise by around 21%. And also the proportion of infections outside the metropolitan region has been on the rise, so has the reproduction rate, which stands at above 1. And also the number of imported cases has been seeing a slight increase, and there's been also 49 variant cases reported in the past week. So there are some concerning factors here. Let's also move on to the vaccination front. The expert of the vaccination task force said that there was a committee that assessed that recent 11 post-inoculation deaths. There was found no correlation between the vaccination and the fatalities. It's highly likely that those people died of other causes. And also there was so far no case that has the correlation between blood clots and the vaccination, which was a recent concern, especially with cases in Europe.
Oh, I see. All right, so thank you for that.
My pleasure.
Right, in a bid to facilitate entry logs at shops and other places of public gatherings, officials at Goyang City have come up with a system that completes the procedure in 5 seconds. Do take a look.
Today we're at a large furniture store in the city of Goyang, north of Seoul, home to over 1 million residents. Here, visitors get on their phones prior to entering the store's premises. This is a mobile phone-based visitor access control system adopted by the city of Goyang for the first time in Korea.
QR코드 찾는 번거로움이 없어서 전화 한 통화로 인증하니까 그 5초도 안 걸리는 것 같아서 너무 좋습니다.
The system only requires users to make a quick, simple phone call on their mobile devices, which helps save time in gaining access to public venues.
실제로 사용하시는 손님들께서 전화 한 통으로 입장이 가능하니까 간편하다라고 말씀을 해주시고, 다음에 또 인증 절차가 간편해지다 보니까 이제 대기줄이 발생하였던 일이 이제 해소가 되면서 주말 같은 경우에는 저희가 50% 정도 대기줄이 감소하는 효과가 있었습니다.
The management of visitor information has also become much easier with this system, which does not require a unique QR code to be generated for each visit.
투기 방식은 개인정보가 유출이 되고, 그리고 남이 사용했던 펜을 이용해서 다시 또 접촉을 해야 되는 그런 불편함으로 코로나가 확산이 될 걸 생각하시는 시민들이 꺼려하셔서 그걸 좀 단순화하는 전화만 걸어서 출입자 정보를 제공하는 방식으로 도입하게 된 겁니다.
Outbreak investigation teams also have direct access to these visitor records, allowing them to identify contacts of COVID-19 patients in just 3 hours.
출입 시간하고 그 해당 전화 거신 분의 그 전화번호만 서버에 남게 됩니다. 그리고 저희가 혹시나 접촉자가 있었다 그랬을 때는 그 서버에서 확인만 하면 그 대상자를 찾을 수 있는 시스템입니다.
The mobile phone access control system has now been adopted in more than 100 regions nationwide, including the capital Seoul. The city of Goyang has always been at the forefront of new tools and innovations in the fight against the pandemic, having been the first to adopt drive-through test centers back in February 2020. The city also operates shuttle buses for incoming travelers to Korea and has converted school dormitories and camping grounds to shelter mildly ill COVID-19 patients. Fresh ideas like these on the local community front could prove to be the difference maker in Korea's efforts to prevent a fourth wave of infections.
국내에서 아스트라제네카 백신 접종의 연령별 이득과 위험 분석 결과에 따라 예방접종으로 인한 이득이 위험을 상회하는 30세 이상에서는 접종을 권고하되
혈전증은 조기에 발견하여 치료하면 중증 악화와 사망을 예방할 수 있는 질환입니다. 추진단은 예방접종자용 안내문을 보완하여 안내하고 접종 후 이상 반응에 대해 조기에 인지하여 진료받을 수 있도록 안내하겠습니다.
COVID-19 inoculations using AstraZeneca vaccines resume on this Monday here in Korea with an age limit. Now, for more on this and other related news, I have Professor Chung Gi-seok from Hallym University. Pleasure to have you with us, Professor Chung.
Thank you for inviting me.
And I also have Dr. David Kwak from Suncheon University Hospital. Welcome back, Dr. Kwak.
Good afternoon.
Right then, Professor Chung, authorities have decided to resume the rollout of AstraZeneca vaccines. What are your thoughts on this?
Yeah, we have to do that because we are totally relying on AstraZeneca vaccine. It is a safe and effective vaccine, but recently, as all we know, blood clot issue was raised in European countries. And EMA and WHO says still that the benefit outweighs the risk or harms. But I think if we have other vaccines like Pfizer, Moderna, and Janssen, then I would rather recommend not to get a vaccine in younger, relatively younger, healthy adults. But now it is clear that younger, particularly women, there is a certain phenomena which is called the VIPIT, vaccine-induced prothrombic immune thrombocytopenia. It's a long term, but it says vaccine can cause a blood clot in your blood vessel after vaccination, the mechanism of which is via immune thrombocytopenia. That will be discussed by Professor Gov'T sometime later in this show. I think it's not a trivial one. We have to consider it over and over. So for the time being, less than 30 years old could avoid from get AstraZeneca vaccine, and then they will get another vaccine. But for their 30s and 40s, we should close look at possible side effects from other countries. Then we can decide again for the AstraZeneca vaccination in those populations.
Right. Dr. Kwak, Korea's latest decision with regard to AstraZeneca's vaccine comes with a clause that excludes those below 30. How do you explain the discrepancy among nations with regard to age limits on the AstraZeneca vaccine? Because I am aware that Korea has the same regulation as the UK, but Italy excludes those who are below 60.
Right. So all these countries, as Dr. Jung mentioned, probably are implementing the same criteria over what age group they're going to limit the vaccination in. So we're not exactly following the UK's footsteps in that, but we also made our own calculations of risk to benefit ratio for different age groups. And among so in the calculation, as we know, the basis on this is that we are seeing clearer increase in mortality and more severity in much older age groups, and we're seeing less of those in younger age groups. But in the opposite way, we're seeing more frequencies of these side effects in much younger generations. So those risk to benefit ratio we're calculating, but if we calculate that, people above 60 are clearly showing much more benefit over the risk. Also, I shouldn't say clearly, but for the people who are less than 30 years of age, they're showing more risk than the benefit. So there draws the line. But there is also the area between 30 to people in the 50s that benefit outweighs the risk in those groups, but it doesn't necessarily outweigh much more than the risk. Meaning, so I can't really call it a gray area, but it's sort of within the margin of error. So those European countries that took the step to limit the vaccination under 60 years of age or 65, they're actually taking the most conservative step so that they could protect any risk for the people in those according age groups. And also, obviously, as Dr. Jung has mentioned, they are also equipped with other options of vaccination. So for those age groups, they can offer those people with other options. The UK, however, has also vaccinated more than 18 million people with AstraZeneca vaccine, and they've apparently have seen about 30-some or 40-some people to have had certain side effects that has to do with thrombotic thrombocytopenia. But those were mainly in the age groups 30 and below. So the UK is claiming that anybody who is above 30, it would be safe to use, so they are going to keep their regulation that people only in the 30s or less, 30 or less would be prohibited from further being vaccinated with this type of vaccine. Korea, on the other hand, we don't have any other options other than some of the Pfizer vaccines that we currently have. But they are currently being used for people above 75 years of age, so they have to be allocated to those people. So keeping it, I guess, rather more realistic in a sense that we still have to, the benefit still outweighs the risk among people of between 30 and 50. That's probably why we decided that only people who are under 30 will be prohibited from receiving the vaccine as of now. But for any other people, because our calculation shows that the benefit still outweighs the risk in those age groups, we're going to keep vaccinating them.
Right. Then, keeping in mind what Dr. Kwok has just said, Professor Chong, included in Korea's second quarter vaccination plan are some 640,000 people under 30. What do you propose as an alternative then?
Yeah, it's very difficult. Before I answer that, I'd like to add on Dr. Kwok's mention about the benefit and harms. Because the calculation I saw in UK and in Korea says that there is a presumption that there will be a certain amount of confirmed cases every day. The Korean statistics say that 100 to 1,200 confirmed cases every day for 3 months is a presumption, which we do not have now. So we have currently 500, maximum 600. Then the benefit of getting a vaccination will be reduced, partly by 50% or so. Then the harmful effect will be higher than the benefit. So we have to always consider that. And if I'd like to answer your question about below 30s, there are not many options, as Dr. Kwok suggested. So the alternatives are we have to get the Pfizer, Moderna, Janssen, Novavax as fast as possible to provide them with those kind of vaccine. One alternative I fancy is Pfizer is provided by for age group 75 and older, and in those population, 15% is not has not allowed to get the vaccination. Did not agree. So if you calculate 15% of those age group, that remains about 500,000. So that kind of amount of vaccine could be converted to age group less than 30. Still, we do not have much other option, but we can think about the cross immunization. One vaccine and followed by another vaccine until we get the sufficient amount of vaccine.
Mixing vaccines,
yes.
Then, I see. Dr. Kwok, for the sake of our viewers at this particular point then, could you tell us a bit about the symptoms linked to blood clots and how can we tackle them?
Right, so I would like to start out by saying this would be a very rare case of person actually have any of these symptoms after the vaccination, but some of the symptoms to watch out for are shortness of breath or sudden occurrences of chest pain, and then there could be an edematous leg, meaning a swelling in the legs suddenly, and then there could be a continuous abdominal pain, and somebody could suddenly start showing neurological symptoms such as sudden dizziness or severe headache or blurred vision. If any one of these symptoms were to occur within, according to the data, 5 to 15 days after the vaccination, one should seek immediate help from larger hospitals, hopefully hospitals that can provide very invasive testing methods and whatnot. But I want to reiterate once again, these are very rare occurrences, so you need to watch out very closely for these very specific symptoms.
I see. Professor Chong, this brief halt in the rollout of AstraZeneca vaccines is expected to have fueled a bit of vaccine hesitancy here in the country. How should we deal with this reality?
There is no clear answer for that because if we have enough other options for vaccine, then I would bravely abandon those kind of risky vaccine in those specific age groups. But we don't have any option. So I want government to try as hard as possible to get alternative vaccine for those who are hesitating. I heard from here and there, particularly the younger women in their 30s or 40s are very much hesitating about getting the vaccine. So it could be a big problem. But still, we have May and June until the end of first half of this year. So I hope the government will get another type of vaccine as much as possible and as soon as possible. And the other one is, again, the disclosure of information very immediately and transparently. There will be a continuous report regarding on the blood clotting in European countries, and also in this country as well. So the government should disclose all the information every day and follow the whole situation. Then they could decide. And another one I would like to ask is Korea Food and Drug Administration to determine their decision again, because the label has changed. In the first place, they didn't have any blood clotting issue in the label of AstraZeneca vaccine, but the label has changed. So there is obligation for them to have a committee and get another opinion, and then the decision could be transferred to KDCA.
Right. Meanwhile, Dr. Kwak, as you mentioned earlier, findings show a tangible drop in infections at nursing homes following AstraZeneca vaccines about a month ago. What more can you tell us about this reality?
Well, they have approximately injected 60% or above of the people who are in regards to nursing homes, whether they be patients or the workers there. And it seems like the infection rate has dropped from 9-point-something% to now currently 2-point-something%. So it has dropped to about a fifth of the original the infection rates. And that's clearly showing the effect of the vaccination. And that's probably all we could hope for in the sense that when we reached herd immunity within our whole population, that's how much the drop will be for all of us. But also in a sense that when, so our main concern is when the numbers increase, it's whether our medical sector can handle the increasing numbers or not. Meaning how many of the severe patients or people who could be dying from the disease can happen from the increasing numbers. And it seems like the KDCA is claiming that due to drop in numbers of whether people with underlying diseases or much elderly ages, they are showing clearly less of the infection rate, and not only that, they're also not progressing into more severe disease and less of the death rates as well. So I guess with these numbers that are currently being shown, I can stay hopeful in the process of vaccinating the whole population. We could see much better results within the population as well.
Right. Professor Jung, let's now take a look at the outbreak here in the country. Authorities claim we are facing a precarious situation at this moment when compared to the height of the third wave here in the country. What is your assessment of the situation?
Yeah, I think the third wave is over by the end of March, and we are at the verge of going into a fourth wave. But still, the number seems quite stable so far, around 500 or less than 600 and something like that. But as we all know, we start third wave with the on the ground a background of 100 confirmed cases every day. But if you like to face the fourth wave, we are starting with 500 confirmed cases every day. And for last 3 or 4 months, we have 25% around unconfirmed cases every day. So that means at least 100 confirmed cases were not confirmed from their infection source. So those kind of numbers, tens of thousands of numbers, have been accumulated so far. It's like a volcano which is going to erupt harshly. So having said that, we are going to see maybe clearly it's more than 1,200, which was a peak in third wave, maybe 2,000 every day or more than that. So we have to be very cautious about that. But the government is still having a position that still maintaining the current status of social distancing. I really miss that kind of position for the government.
Right. And staying with that, Dr. Kwak, what are your thoughts on the decision to maintain current social distancing guidelines at level 2 for a lot of the other regions and level 1.5 other places?
I'm actually personally more hesitant towards making any judgment on the social distancing level, how much of a effect that it has on our population at the current state. Because whether we increase it to 2.5 or we stay at 2.0, some people are going to still go around and find their own ways to go around it. I've seen personally some cases in some restaurants that they were letting in people more than 5 or 6 or 7 and 8 even, claiming that they would just claim that those were just family members. And these are manipulations of these regulations that the government is currently implementing. So in that sense, I'm not sure if raising the social distancing level up to 2.5 will do much of a better effect at this point. But obviously it will have a rather scare effect, so that people who were actually going out more loosely now will be more reluctant too. I personally think rather more pinpoint type of tactics should be implemented here, meaning they should be more aggressive in regards to screening of the people. They should probably mandate a certain period of group very frequently, all of them to get tested through RT-PCR, whether that be religious sector, whether that be financial sector. Very frequently for all these groups, they can, whatever the groups that they can find, they should go ahead and start doing a preventative screening, meaning those people who don't necessarily speculate to have virus, they should still go ahead and have tens of thousands of people be tested at once for preventative measure. But otherwise, I think overall, it's really not so effective in a sense, efficacious in a sense that if we start mandating everybody to be limited to only 3 people instead of 5 or 5 instead of 7, as we have seen before, it's not going to have as much of an effect as we have seen with other 2 or 3 waves before, because people already know how to manipulate them.
Right, unfortunately. All right, Dr. Kwak, thank you very much for your thoughts, and Professor Chung, thank you very much for your insights today.
Thank you.
Right, now do remember that failure to keep your face masks on at all indoor venues outside of your home will result in fines starting on this Monday. So do take care. Thank you for watching.